Welcome to the IHF program. I'm Xavier Freixa from Barcelona, from Hospital Clinic in Barcelona. I'm interventional cardiologist. With me, I have the pleasure just to be with Philipp Lurz, an expert interventional cardiologist from Mainz. And today we're going to be talking about right heart failure and tricuspid regurgitation. So Philipp, what are the main challenges for right heart failure and the treatment?
I guess the most important challenge is that our knowledge and understanding of right heart failure is still so limited. It didn't get the attention in the past. There's very little in the guidelines. We don't have properly established medical therapy, and we still don't understand the importance of afterload and preload and how to help patients with right heart failure in the best way. But there's also some hope, because I think that with additional and new innovative therapies, especially also interventional therapies, there's more attention now on the right heart. Imaging, treatment, observation of changes with treatment, and all of that, irrespective of what the therapy does, should enhance our understanding of the right ventricle, because there we have to still learn much more.
Good. So you know that recently, like 2 large randomized trials, TRILUMINATE and TRI.FR trials have been published. So can you just summarize like really fast and just tell us if they change your practice?
What these randomized trials have shown, that in patients with significant TR and volume overload and symptoms, we can successfully reduce tricuspid regurgitation, we can reduce right ventricular volume overload, and that has tremendous benefits with respect to symptoms. Where the signal isn't that strong and clear yet is with respect to hard clinical endpoints. No benefits with respect to mortality, some positive trends with respect to heart failure hospitalization, but that's probably also due to the fact that the follow-up was only 1 year, and after that patients crossed. And I guess with tricuspid and right heart disease, one has to wait a little bit longer to see these benefits for hard clinical endpoints.
Good. So then what's your perspective? How you see the combination of, this medical treatment and, all these new transcatheter therapies or even surgery? How's the future?
Yeah. So I think that maybe when it comes to right heart physiology, we are always obsessed with afterload, and afterload is extremely important, and we have to optimize also with medical therapy to reduce right ventricular pressure overload. But we have neglected a little bit the importance of right ventricular volume overload, and that's something we can also treat with drugs, diuretics, but we can also now reduce right ventricular volume overload with the devices we have to reduce tricuspid regurgitation. We should do that early enough before changes became irreversible, and all of that together, I think, will give us a good chance to finally make a difference when it comes to right heart failure. Obviously preventing right heart failure, but also treating it better once it occurs.
Good. Okay, so I think that it's been a very good summary. I don't know if you want to help me, but I would say that the take-home messages of this interview would be that maybe when we're talking about tricuspid regurgitation and right heart failure, there are a lot of challenges. There's lack of knowledge, and probably we're learning every day from that. Also, that this TRILUMINATE and TRI.FR, and they show that there is a benefit in quality of life, but no benefit in heart failure admissions or mortality. So again, probably we need to wait some more time, just to get this benefit from the therapy. And maybe third, that this combination, of medical therapy and transcatheter therapies, it has to be like really close. There is a lot of room just to improve in the preloading, the afterload. So I think that, the combination, working together with our colleagues from the high failure, clinic is going to be important. So thank you, Philipp.